So again, I just wanted to start by telling everyone how exciting it is to be here. It just does seem like the time is ripe now where so much great work has been going on for so many years that it really is that next step to what action now follows that. How do we really move this to really impact the policy and the practice? And part of what we have been working at in my organization is to do just that. And so I'm going to tell you a little bit about the process that we went through, why we went through it, what we hope to achieve, and what we're seeing as preliminary results. I've been with CUPS, which is a community health center and has many other social resources. We really have three pillars: education, housing, and healthcare that we offer. And I've been there for about 17 years. My background is I have an undergrad and graduate in education. I have an undergrad and graduate in business, and I have an undergraduate in psychology. So not really the most usual ingredients to run an NGO, but I can say that all of those degrees that I got were well used. I think if you don't understand people and how they think and how they move and what motivates them, it's difficult really to do any strategic planning and run any company. So to me, I always saw our organization as an empowerment center. I really shied away from really being called a charity or even a not-for-profit, more into trying to be something where people could say, why would you come here? Why would I use you versus any other government resource? And when I do our staff development training, particularly for our executive leadership, that's what I ask them to answer that question. Why should people come to us? Why should donors give us money? And why should government support us and not do it themselves? And if we can't answer that question, I think we have some serious challenges ahead. So we really looked at where we were going probably about now 10, 12 years ago in terms of what we wanted to be as an NGO and where we wanted to be and what we thought we were good at and how we were going to get there. And that's been an incredibly long process. We started off as the biggest resource that we had was a health clinic. And we offer absolutely everything any kind of small or medium-sized clinic would in terms of primary care, maternal health, prenatal, mental health, foot care, dental. We really do a whole gamut of different services. And we also take that into our community resources and into our participants' homes. We have about 17 mobile clinics and on a monthly basis, and we serve over 200 families each month into their homes. So we knew that by really looking at where we wanted to go, we had to figure out how we were going to do it differently. So 10 years ago, I opened my first child development center, and it was called the One World Child Development Center. And the main focus and mandate for our organization is to serve low-income families. And we follow the low-income cutoff rate. Income tax assessments are required to prove to use our services. But that is really the only difference than a clinic that is 10 blocks north to us. And that was always going to be our mission. About 10 years ago, we opened our Child Development Center, and at that time, we had a very well comprehensive child development aspect of it. We had a team of specialists, psychologists, psychiatrists, speech and language pathologists, occupational therapists, physiotherapists, pediatricians, nursing, teachers, support staff, social workers, all doing a very intensive assessment and interventions with our children. And we had a smaller subset for the parents, but it definitely was mandatory that the parents had to come to certain subsets of parent development, relationship therapy, skills and training development, a whole host of different activities. But it wasn't based on the science, and it wasn't that thorough. And what we saw was the children excel, and we didn't see the parents excel. Although great things come from all the things that you learn. You learn as much from the things that you didn't do well as you did do well. So we identified that quite quickly. And we do have, the exciting part is that we do have 10 years of verifiable data with the University of Calgary in Alberta. And one of the things that I thought was incredibly different that we'd ever did before back then, 12 years ago, when we started that school, we developed as part of the preceding thoughts and planning for that program, we developed a partnership with our University of Calgary, under the Faculty of Nursing. And that was a very formal evaluation of that program. And I personally believe that was critical in the after years, even with the mistakes and the gaps that we made in adding credibility to that program, and to really being able to sell that to funders, to really sell the data that came from that research, and be able to really learn as much from the things that we didn't get right as really full stream ahead with the things that we did. So we really, in the last probably 7 years, which is, I must say, we are in Alberta incredibly blessed to have the Norley Foundation. We've been a partner with them for over 12 years, which if you notice at the One World Open 12 years ago, there's no coincidence there. And probably years later, it was probably about 2007 or 8, that we decided as an organization, that my board of directors and myself, that we were really going to start really making that strategic shift from just adding programs that people said they needed, or that would be a quick fix, or that we could get funded, into really starting to build a culture of change that was going to follow the science. Now, you might remember this morning when Michelle talked about from Norlean that was around the time that Alberta Family Wellness Initiative launched their big forum that has been an amazing resource, leader, and social change for us in Calgary and Alberta, Alberta as a general. But it was around the same time that we started saying as an organization, we want to be part of that. This is amazing. You know, it really doesn't take much to really understand that as an adult, it's a 1-to-1 return ratio. As a child, it's a 1-to-7. And although I absolutely agree we got to care for the people of all ages now, we do know that starting early with everyone coming forward is the way to go. And so we really wanted to be a part of that. So we looked at really holding a lot of forums, not only with our board of directors to start off with, and our senior management team, and our staff as a whole, our volunteers, our community partners. I took a lead on a interagency community forum that was happening in Calgary at that time, and it was really for executive directors, and I really, really wanted them to get excited about the potential of where this could take us. I sat in our poverty reduction initiative that was launched by our mayor in our city. I'm involved with the Frontiers of Innovation on the advisory level, and as a site with Harvard University at Center for Developing Child. And I really wanted people to learn and to grow and to be excited about this new information coming up. But then I was hit with a really interesting question. Not only just, so what? What can we do? I was really hit with, where does this even begin? How do we make this level of change, even if we want to? So we really spent a lot of time talking about the things that we all know. Early childhood is critical period, that we need buffering effects. And to me, it was really a call, when we talked about it at the community level particularly, it was really that there was this urgent call. Even if we didn't know how to get there, then we would be able to navigate if we really kind of could just take it step by step. It was interesting because there is a bit of a division, at least in Alberta and in Canada to some degree, but I'll talk specifically about Alberta. There is many not-for-profits or NGOs that really do want to go forward. They don't really know how to let things go that maybe wouldn't fit, that they already have funding for, that's really covering a lot of their administrative costs, how to train their staff, but really they're willing to do it if there can be a collective help. And we are, again, fortunate that Norley Foundation has taken such a leader role as a nucleus in our bigger systems. And then there is some NGOs that really just aren't ready to do that. And my encouragement, and I have spent a lot of time with each one of these individually, each one of these groups, is to say, who's willing to go forward? Let's go forward. And maybe that will be lessons learned, and maybe we can be the beacon of hope, and really even maybe the leverage for them, whether it's financial or resource-wise, where we can help other people come up over the ladder. So it really, in my opinion, was no different than helping a child who's disadvantaged come on up by someone who has more. I really saw that as the NGOs, could we not go forward and then help others up as they come along and become more engaged? There is going to have to be enticing factors. People are going to need either resources for training or financial administration, whatever it is. But I think that can all be figured out as long as we can sell all these different things that really are compelling based on the science. So when we successfully had our first child development center, our health clinic launched for about 10 years. We embarked on a capital campaign because we literally ran out of space as an agency, and we embarked on a capital campaign that saw us raise $20 million and move from 18,000 square feet to 52,000 square feet. We did it in a time of recession in Calgary, which was We certainly aren't crying, because I know that means very little to you, and it sounds like we're whining when we shouldn't be. But it was a bit of a trying time, so we weren't really sure how that would work, but it actually was very successful, and it allowed us to move into a beautiful new facility, 3 levels, and we were able to open a second child development center that married our prenatal and women's health program into this One World Child Development Center that serves children 3 to 6 years of age and their parents. It was absolutely, for the first time ever, even with One World, I would say it was a great deal based on the science, but as I said earlier, there was a lot of things we didn't do, and I can tell you, trying to piecemeal science into an already existing program is, if you can help it at all, very, very, very not worth it. It is incredibly difficult, it skews your results, there's a lot of unknown factors, it's a lot of tendency for your staff to fall backwards into old ways of doing things. So in this new development space, we started completely. We revamped our whole education pillar. We spent over a year and a half doing all the due diligence, training our staff and getting our leaders in place, making sure that we had all of the right requirements and expertise in-house that could run this facility that was married to what the science told us we needed to do. We did an overabundance of training, and then we started bringing in the parents first. And the parent program, we based both of our programs, Nurturing Parent Program, Steve Balvalock, and the Supporting Fathers Initiative, which is, of course, Carla Marcia Pruitt. And we put both of those in place. There's a whole series of assessment forms that we do. The parents have to be engaged. What we did different, and I'm happy to share all of our measurement tools, prior to even launching this program, we did a very in-depth program design with the University of Calgary, again, at the Faculty of Nursing. And we absolutely were like a little Bible trying to follow that program design. But without that program design, we really didn't have an incredibly strong structure to hold our staff and volunteers accountable to. And so although that was an expensive piece of the process, it was very, very critical to the foundation and to the testing tools and to everything we were doing. But what we were able to do was really kind of scale it up or make changes also as we needed to for things that didn't fit. But for the first time in our entire history, and I would challenge a lot of NGOs on this, we weren't just doing a program because it's what we felt we needed or because it was what we could have or afford or really at the time was available to us. We did this program not only totally based on the science, the criteria for entry was medium risk or less. And that is what the science said we could have the most impact on. And so we had to figure out, well, what do we do with the higher risk families? What is that preliminary step that can get them ready for this? But by separating those two groups, we heard, and I will tell you, I'll give you the end spoiler, I don't have any real data to share with you because this is fairly new. We just launched this last fall. But I'm happy to come back next year and tell you all exciting data. But we know that the preliminary results we're seeing and we're hearing in our focus groups is the parents are saying to us, I'm so glad we're not all clustered together in one group just because we're all low income. I'm so glad that those motivated are separated from those that might be holding us back. We need to help everyone, but can't we do it differently? Because I was frustrated coming when we had to slow things down or we had to put things into more condensable versions. And I want to go. I want to change my child's and my family's circumstances. And that was really interesting to us, I must say. And I tell you, I learned more from those focus groups, even after 17 years, than I learned from anything that I do, because you just never really know exactly how they're thinking and feeling. So we've heard some great results. We've seen our retention rate is now about 96%. It's really interesting to see that they're coming, they're excited. We're seeing the change difference, there's no question, by embedding the family wellness and looking at being in their home, engaging them in their community. We're really, really seeing the fruits of that. So this is just, I'll be quick on this one. On our logic model, we had a lot of the elements. Like I said, we did looked at health, education, and housing because we knew if families weren't housed, they're not stable. We're not going to have consistent routines. We're not going to have regular day-to-day interaction. Even serve and return on an intimate level with the family was really difficult to happen. So we knew that needed. And in Calgary, just on a very side note, we have very little, if any, affordable housing because we have we have less than 1% of affordable rental space. It's a very difficult time. We always knew education for the child and the parent in center, in their home, and in their community was vital. And with our housing, with our healthcare, we always knew that primary care was a piece of it, absolutely. Prenatal care was absolutely a piece, but the other was mental health. Their supports, their family connections, their relationship, all those type of things. So we had already set aside that we knew that family well-being and that a stable home and a quality of life were the three things we were striving for. So we had a lot of the pieces. What we didn't have was the evidence and the structure and the training and the consistency of all those three to really make the data really come viable. So we developed that, we talked about that, we totally around the science. I talked earlier about modifying our existing programs. We did that with our first child development center. It was really, really tough. We now followed our early brain development model. I'll tell you, the ACE is an amazing tool. It absolutely is, and even in our focus groups, because we serve over 35,000 families through our health clinic, but we also serve over 250 families a year. And we definitely, when we do the ACE scores, they will tell us that, like it isn't just that I'm a bad parent or a bad person or just screwed up. Like there's actually rationale why I have done some things I've done. It does justify, but I would absolutely take it to a much bigger step beyond ACE and say it's also about early brain, because the early brain development tells them how they can change it for their children and how we can make this not a generational issue. So to me, the ACE gives them the aha, and even epigenetics I think is amazing for people to learn that environment plays as big of a role as your DNA. I think that's amazing. So the mechanisms of change that we use was our two programs, main programs, very intensive, very high commitment for the parents. We also do evening fun, family fun night. We have the supporting fathers where dads just come in and have to talk, have a chance to just get together and do a roundtable. We also now have figured out we need to do relationship therapy. If mom and dad aren't getting along, or mom or the other significant partner are not getting along, it is really tough for them to be able to be nurturing in their community and to their children. So at the end of what we have learned when we embedded this new complete pillar and are now really doing the same to our other two pillars, is we took our logic model and made it into a much more realistic version of things like we looked at the coping resources of the families. What do they perceive is things that they have strengths? What do they really have? Because just like one of those graphs where we talked about the happy to sad face, their tolerance for what is normal is way beyond mine. So we really do a lot of work in that area. The moderators are really about where they come to us with, and it can be at any stage, but we modify our scales and our programs to wrap around that. And then of course, we have the stressors, we have our perceived impact, where they see it again, where they're at, and then we had our three same solid outcomes that we really try to perceive. What's different is, is that we now looked at parent and parent, whether that's two caregivers, whether that's two co-parents, whatever that may be. The other caregiver and that parent is primary, and the child, their relationship is equally as important as their relationship to the child. We were the wraparounds that really can start looking at stable environment. What can be their support systems? We go into their neighborhoods, we click them up to groups that they can connect with, other individuals they connect with. We have 4 apartment buildings that we manage, and what we do is we have volunteers and different church facilities and different volunteer entities that come in to those buildings and really just have fun nights where they start making friends with different volunteers. So they're starting to make community supports. And this one mom said to me one night, which I thought was amazing, she said, I've really gotten to like that group of volunteers that come in from the law firm. She said, imagine me friends with a lawyer. So it was very interesting to see where she felt she was. And then, of course, we have our larger community that plays an amazing role into all of this. And being told to hurry up sometime. And so, of course, the aim is to keep fidelity to the program. We are looking to the feasibility of using these new databases, which that was the other big thing. We completely had to change our database and softwares for what we were collecting, which was big, but it's absolutely making such a difference, training all our staff on it. The evaluation and continuous improvement is an ongoing thing. As I talked about, we're involved with Frontiers of Innovation, and of course, we're involved in many other projects. And we're absolutely, I guess for me, the why not and the what do we hope is success. We hope that this project will advance our knowledge of how to best design, scale up, and evaluate innovative and promising practices for improving lives for children. Because that last sentence, improving lives for children, the science says this is how you do it. That's what we're committed to doing. Thank you so much.